Hi everyone, my name Dr. Bzour. I'm a cardiologist. I work at KSB Hospital. I have been here for almost 19 years. Um, I am specialized in interventional cardiology. Um, that's a specialty where I perform specific procedures for the heart. It is a great honor to speak to everyone here, and it is a great month. We call it Heart Month, the February. It is the month where we reflect on heart problems, and we try to do our best to educate the public about heart disease and heart problems. Heart disease is number one killer in the US, and the good news, it is preventable. So the more we learn about it and the more we know about our health, the more we're able to prevent heart disease, and the less you need to see a cardiologist. A cardiologist is a medical doctor who spent 8 years medical school and then specialized in internal medicine, which is general medical education, and then specialized in cardiology. And then after specializing in general cardiology, many of us specialize in different branches in cardiology. So I happen to be interventional cardiologist, which is I'm specialized in opening the arteries of the heart. When there is a blockage in the arteries of the heart, I go ahead with a little camera and wire and balloon, and I open it up, and I place a stent. And also, interventional cardiologist takes care of any blockages in the circulation anywhere. If there's a circulation problem in the legs, we also go ahead and unclog any blockage so the patient can feel better. As a cardiologist, we deal with all kinds of heart disease. So if there is any problem in the arteries of the heart, which is there is a blockage, that's the most common thing we deal with. But we also deal with variety of problems. So if there is electric problem in the heart, like the heart goes fast or slow, that's something we deal with. Patient may need a pacemaker. That's something we definitely take care of for the patient. Some patients may have valve problems. So if there is a valve that does not open well or a valve does not close well, that may lead to shortness of breath, congestive heart failure symptoms. Definitely we diagnose and treat these problems. Also the common disease we deal with, especially in older people, is congestive heart failure. When the heart doesn't pump very well, then patients start getting short of breath, start having swelling in the legs, and we treat and diagnose all these conditions related to the heart. As cardiologists, we listen to the story. We, physically, evaluate the patient, examine the patient, and we run testing on the heart so we can evaluate the problem and diagnose the disease that the patient has. So we do some, EKG, echocardiogram, which is ultrasound of the heart, stress testing to look for blockages in the arteries of the heart, different kinds of monitors. And what top all this is cardiac catheterization, or what we call an angiogram. So in these procedures, we're able to take a small camera and go from the little artery in the wrist and take it up to the heart and see what's going on. And if there is any blockage, to take care of it by placing a balloon and a stent there. And we're all able to do all these procedures definitely in our local hospital here in KSB. We get asked a lot, when should I see a cardiologist? I mean, there are some symptoms to suggest that you may have heart disease. So if the patient has chest pain, especially when they exert themselves, or if the patient has shortness of breath, or they're retaining fluid, like they have swelling in their legs, or they all of a sudden gained weight, or if the heart goes fast, like they're fluttering, or if they feel dizzy, especially when they exert themselves, or if they pass out. That could be a sign of a heart problem or heart disease. So these are the conditions that we get referral for all the time. The cardiologist will listen to your story first and then do physical examination, and will go ahead most likely to run some testing to help him diagnose the problem. And then will, if you need certain procedures, we'll go ahead and plan for that. And we give medications most of the time to help the underlying problem. We also get asked a lot, do we need a referral to see the cardiologist? I mean, we really don't mind seeing the patient directly without a referral. So personally, we don't see a problem with that, but some insurances may require that. And some primary doctors, they like, to know at least that you're coming to see a cardiologist. And also they like to do the preliminary investigation sometimes before they let you come and see a cardiologist. So personally, we don't mind, but as a courtesy, I think the primary doctor will be the referring physician normally, especially if your insurance doesn't care. I just want to thank everyone for giving me the opportunity to speak to you, and I am so thrilled to be part of KSP community. We have a great cardiology department. Me and Dr. Hanif and Dr. Dali, we're a group of cardiologists. We're all very experienced in dealing with a variety of heart problems, and we're so happy that we're able to help our community to stay in our community and not to go and they travel very far to seek for any medical help related to their hearts. And thank you again for giving me the chance to speak to you, and have a beautiful and healthy cardiac month.